Imagine living each day in constant pain. Every movement a reminder of what you've lost, every effort to find relief leading to a dead end. As a board-certified neurosurgeon, I want to share a remarkable story of a patient whose life was transformed through the power of modern spine surgery. Did you know that up to 70% of hairdressers experience chronic pain during their careers? Today, I'll walk you through the journey of one such professional who spent 5 years battling debilitating pain that threatened not just her career, but her entire way of life. Her story illustrates how advanced diagnostic techniques and surgical intervention can offer hope when all other options have been exhausted. Before we dive in, let me share something important. In my years of practicing neurosurgery, I've seen countless patients who've tried everything from physical therapy to pain management, only to find themselves still searching for answers. What makes this case particularly compelling is how it demonstrates the critical role that precise diagnosis plays in the finding the right solution for chronic pain. Let me tell you about a remarkable woman who came to our clinic after a 5-year battle with chronic neck pain. As a hairdresser, her livelihood depended on being able to stand for hours with her arms raised, a position that had become almost unbearable. The pain radiated from her neck to her shoulders and the scapula, making every workday a test of endurance. But it wasn't just about the physical pain, there was an emotional toll too. The joy she once found in her craft was slipping away, replaced by frustration and despair. She had done everything right, sought help from multiple medical specialists, tried various treatments, but nothing seemed to provide lasting relief. Each failed attempt at finding a solution left her feeling more hopeless. Her profession, her passion, and her daily happiness felt incredibly out of reach. When she visited our office, we took a different approach to understanding her condition. While her initial MRI showed what appeared to be mild disc degeneration, which is a common finding that doesn't always cause symptoms, I knew there had to be more to the story. That's when we employed the use of a specialized CT SPECT scan, which is a diagnostic tool that can show increased inflammation in the spine. This scan revealed intense inflammation at the exact disc space causing her pain. This was the critical clue we needed to pinpoint the source of her suffering. We had an honest discussion about her options, including a surgical option called an anterior cervical discectomy infusion, or ACDF. This procedure would allow us to remove the problematic disc entirely and stabilize the vertebrae using a small cage containing bone material, along with a plate and screws. One of the advantages of this approach is that we access the spine through the front of the neck, avoiding the need to cut through the muscles in the back of the neck. This typically results in less post-operative pain and a smoother recovery process. The surgery itself went exactly as planned. We carefully removed the damaged disc and decompressed the affected area, then stabilized the spine with the necessary hardware. Throughout the procedure, we took great care to ensure everything was perfectly positioned for optimal healing. What happened next was nothing short of transformative. Almost immediately after surgery, she noticed a dramatic reduction in her pain. Within weeks, she was able to return to the work she loved, rediscovering the joy that chronic pain had stolen from her life. Her resilience through this journey was remarkable, and seeing her reclaim her passion for hairdressing reminded me of why I chose this field of medicine. This case perfectly illustrates the profound impact that proper diagnosis and appropriate surgical intervention can have, not just physically, but emotionally and spiritually as well. Through advanced imaging and surgical techniques, we were able to address the root cause of her pain, allowing her to return to a career she loved and a life she deserved. The journey from chronic pain to renewed hope is one that I've witnessed countless times as a neurosurgeon. This patient's story reminds us that even when it feels like you've tried everything, there may still be a solution waiting to be discovered. Her resilience in the face of debilitating pain and her determination to reclaim her life serve as an inspiration to others facing similar challenges. If you're struggling with chronic neck pain, especially if it's affecting your ability to work or enjoy life, don't give up hope. Modern neurosurgery offers solutions that can help restore your quality of life. The key is to getting an accurate diagnosis and understanding all of your treatment options. Remember, your health is your most valuable asset. Listen to your body and don't hesitate to seek specialized care when conservative treatments aren't providing the relief you need. If you found this video helpful, please like and subscribe and share it with others who might find it helpful as well. Thank you so much for watching, and I'll see you next time.